Hello, welcome back to my channel if you've been here before. If you've not, my name's Zoe, I'm a vet physio at Fit Pet Physio, and in this series of videos we've been actually rehabbing my own dog Jack from his recent surgery. So he ruptured his left cranial cruciate ligament, which is basically the doggy equivalent of your ACL, on the and he had surgery for that on the 25th of April. So we're now about 10 or 11 weeks post-op, depending on when you're watching this video, when I get it out. So I thought we'd look back at the first 8 weeks, 9 weeks, basically 2 months post surgery to give you a little bit of an update of how that went, what you can expect if you're considering surgery for your own dog, all that sort of things. If there's anything else you'd like to know, please drop a comment down below with any questions and I will answer those for you too. So Jack actually had to wait 5 weeks for his surgery. We were quite happy to wait because we wanted to see if we would be able to conservatively manage it, how severe it was, all that sort of thing. But in the end, we did x-ray it and we found out that he'd fully ruptured his cruciate, and then over the couple of weeks until a surgery date, he slipped in the garden and actually was a little bit worse on it. And at that point, we were like, no, definitely going to do the surgery. We'd never really wanted to do surgery with him just because he's not a very steady dog. So he does like to run, he does like to jump, which obviously they can't do for like 12 weeks after surgery. So we didn't want to risk him doing more damage to the leg, basically, if he did something stupid after the surgery. But in the end, we had to do it because he also needed part of his meniscus removing because he'd managed to rupture that too. So he had his surgery on the 25th of April, where they basically cut through the bones in his lower leg and move them so that when the weight comes down through the femur onto the tibia underneath, the femur doesn't move as much. So they've moved this bone forward so that it can't move forward as much when the weight comes down on it. And they also removed his meniscus because he had torn that and that was causing him some pain. So it is quite normal for dogs to initially be worse after surgery. So we were expecting him to come back worse than he went in before surgery. And later on in this video, I'll show you the videos before and after and throughout the next couple of months. So for the first 2 weeks, Jack was on crate rest. We were icing his leg for the first week because you get quite a lot of swelling after surgery. And then we were using the pulse mag, which is basically a big magnet and it helps to reduce pain on the acute setting, along with all of his pain medications that he had 3 times a day. So he had gabapentin, paracetamol, and he had Metacam as well for the first week, along with his antibiotics. And then after that, we just kept him on the Metacam, which he's been on for a couple of years now for his arthritis, and we changed the pulse mag to just 2 times a day on the chronic pain setting. We also added in some very light physio exercises, so some passive range of motion just to make sure that his joint was moving still. And like I said, he had arthritis in some of his other joints, so we wanted to make sure they were moving because obviously he wasn't walking anywhere. He was just going on the grass in the garden to go to the toilet on the lead, walking very slowly, and that was it. We did also do some standing exercises, so we fed him in the kitchen so that he would have to practice standing a little bit and standing for his food, but in between he was crate rested all the time. Once we had the stitches taken out, we were able to take his cone off, which meant he could do a little bit more, which I'm sure he was very thankful for. He was able to start chewing his toys again. He was able to, eat treats in his crate, that sort of thing, because obviously when he had his cone on, he wasn't able to do that. After he'd had his 2-week check where he had his stitches out, we were also able to increase his walking. So we started off by doing 3 5-minute walks a day, and then by the 8-week mark, where he had his third checkup, we were doing 5-minute walks, because he had a checkup 3 days post surgery, a week post surgery, 2 weeks post surgery, and then 4 weeks post surgery and 8 weeks post surgery. So there was a lot of checkups. So it was actually his 5th checkup. So he had a lot of checkups. It was really great because we got to see the vets and the nurses, and they were able to answer any of our questions. They were able to make sure that he was on track and he hadn't done anything that he shouldn't have. So he was still crate rested for those 8 weeks. And then after his 8-week checkup, we did x-rays as well to see how it was healing. And once we had those back, we were able to allow him out of his crate. Still no running or jumping, still on the lead for exercise. But we were able to do some more physio exercises as well. So we carried on with our passive range of motion. And instead of just doing standing, we did some weight shifting. And then at the 6-week mark, we started adding in some sit to stands. And the 8-week mark, we started adding in some port exercises to really challenge that leg. Because as you'll see later on in some of the walking videos, you can really see where he's lost strength in that left hind and he's lost muscle in that left hind. I think mainly because we had such a wait for the surgery, so he wasn't doing anything. Really, he was doing a couple of 5-minute walks here, for basically 2 months after the surgery. We were just doing 5-minute walks, and for the 5 weeks before the surgery, we were only doing 5-minute walks. So that's quite a long time, like nearly 3 months of just doing short walks. So he'd lost quite a lot of muscle compared to his normal. Obviously, before the surgery and shortly afterwards, he was still in quite a lot of pain with it, so he's not been wanting to use it, and he is quite a sensitive dog, so if he thinks it will hurt, then he won't use it. So we've just been gradually increasing his confidence and trying to get him a little bit more happy using that leg, and hopefully you'll be able to see that in the videos later on, which I'll talk through with you. So after his 8-week check, we had bought him a raised bed because obviously he's not allowed on the sofa, but you can see this one puts him nice and close by the sofa so that we can still stroke him. He still feels a part of everything. We did have to initially just keep his harness and lead on to get him used to being on that bed, but he settled really well, and he even let us start doing his pulse mag on his bed and everything, and he loves it now. As you can see, very settled, not bothered. The lead is just very loose, just in case he tried to get up. But he only tried to get up a couple of times, actually. He is a pretty quick learner, so once he realised what we were doing, he was quite good, and he did realise pretty quick what we should be doing and what we shouldn't be doing. So let's have a look at how his walking progressed from pre-surgery to the 2-month post-surgery mark. So this is 1 day pre-op. You can see that he's not really putting much weight on the left hind, and he's offloading that left hind and he's pushing all the weight onto the right hind, which is more underneath his body. And he's sort of therefore not walking in as straight a line as he could have been. So this is 1 day post-op, and you can see that he really struggles to put weight on the left hand and isn't really putting any weight on it at all. Even when he's stood still, he's knuckling his paw over, so he's not putting the paw the correct way round even. Then this is 1 week post-op, so you can see loads different. He's putting the foot down, he's putting weight on the left hind. He's obviously still limping on it and it's still quite swollen, but other than that, he's made great progress. So 2-week post-op, we're using the left hind well. We've lost a little bit of muscle, obviously, but we are quite happy walking on the left hind, but we are only going out for toilet breaks, so we've not really tested it that much. It's not had much stress, just a little bit, just to gradually get his confidence that he can put it down, he can put weight on it. Then week 3, we started doing proper walks, and you can see once we start doing the 5-minute walks and he's having to use it a little bit more. So this video was taken at the end of his walk. You can see he's limping now on the left hind, which we hadn't seen the week previous. It's quite normal that the limp will get slightly worse as you start doing a little bit more, but this should quickly resolve. And you can see by week 4, he's offloading the left hind, but we're better walking than week 3. We're not limping as much. He also went for a vet check this week and they were quite happy with how he was progressing. they were quite happy that his limp hadn't got any worse, that the joint was moving really well and it wasn't swollen or anything like that. So 5 week post-op, you can see he is loading the left hind better. He's got a subtle sort of limp there, offloading of that left hind that you can still see, but he's walking more or less with weight on the left hind pretty consistently. So this is from behind, you can see a little bit better that by week 6, we're walking quite nicely, putting weight on the left hind, but we've got quite a short stride, so the leg isn't really going anywhere. So the amount of time that it's on the floor is still quite short. So although we're putting weight on it quite well, we're not really putting much weight on it because it's not on the floor for very long. Week 7, we can see that we're walking better. You can see a little bit more clearly here, now that his fur's growing back a bit, that where the muscle has gone. And you can also see that we're still taking short strides, and when we walk really slowly, he's struggling a little bit to put weight on that left hind for that longer period of time. By week 8, we were striding out a lot better. We're starting to get a more even, longer stride, but again, it's a little bit more obvious then when he's taking that longer stride where we've lost the muscle and that the power in the left leg isn't quite the same as the power in the right leg. And then 2 months post-surgery, which was technically about 9 weeks after his op, we've got a more normal walk for him in terms of his stride length, his demeanour. He's happier, he's looking around, he's wanting to go, he's stretching out those legs a little bit better, and he's overall looking a lot happier.